Get the gift of the jab this Christmas is the message from the government. And in Swindon, it was one many were heeding. This vaccination centre busy this morning, with most here getting their booster.
At the end of the day, I'd rather have the booster and be protected than wait and possibly get it and infect my family.
This was the earliest appointment I could get, so yes, as safe as possible, as soon as possible.
Such is the festive push to get jabs into arms. In England, people will even be able to book a booster on Christmas Day.
Across Spain, Swindon and Wiltshire, we've normally given 6,000 vaccines a day. We're now doing 20,000. Having an endpoint to it helps, but they're just motivated to get this done. They are incredible.
That motivation driven by the staggering number of people testing positive for Covid last week. A record 1.7 million people were infected with the virus in the UK, up 58% on the previous week, with the worst rates in England, where 1 in 35 people caught Covid.
After 2 years of this pandemic, I can't say that we're through it.
That's why in his annual Christmas message, the Prime Minister is urging people to get the vaccine.
And though the time for buying presents is theoretically running out, there is still a wonderful thing you can give your family and the whole country. And that is to get that jab.
Vaccines and the possibly milder Omicron variant are helping to keep hospitalisations down for now. But the fear is soaring infection rates will cancel all that out.
If public services are not functioning, then we're in real trouble. And remember, the fact that the NHS has more staff who are isolating or are unwell themselves because they can be exempt from some elements of isolation means that other people with healthcare needs that are not COVID are also not being treated.
Further restrictions are coming in from Sunday in Wales, Scotland and Northern Ireland. But England is sticking to Plan B measures. The next few weeks will be key as to whether that stays that way. Sejal Karia, ITV News.